Cocoa, fast becoming the latest caffeine craze. It's a cocoa powder that people are snorting, and it's raising concerns from lawmakers. The powder is being marketed like a drug. Senator Chuck Schumer is calling on the FDA to step in. Joining me now is Dr. Mikhail Varshavski, better known as Dr. Mike. He has more than 2 million followers on social media, and he's also been named Sexiest Doctor by People magazine. Dr. Mike, thanks for joining us this morning. Good to see you here.
Yeah, absolutely.
All right, so first off, we want to get your take on this Coco Loko snortable chocolate craze.
I never thought there would be a craze about sniffing chocolate. That just sounds crazy to me, number one.
First of all, I don't even get it. Like, what's wrong with eating chocolate?
Yeah, enjoy the chocolate. It tastes so good. Why would you bypass that whole system?
All right.
I guess for calories' sake, people are saying they can get the natural high of eating caffeine, eating chocolate, without necessarily getting the calories.
Okay.
But if you think about it, what's in chocolate?
Cocoa, sugar.
Sugar, right?
Yeah.
Whenever there's sugar, bacteria love sugar. So now you're snorting the stuff, it's going into your lungs, getting bacteria, you're getting an infection. That's the bottom line here.
So should the FDA put some sort of ban on this like Chuck Schumer is calling for?
I think we should start looking into it because you're going to get an increase of infections here, whether you like it or not.
Or should we just know that some things are probably not good for us?
You know what? It's common sense above all. That's really what's key here. If you're snorting chocolate, there's something wrong. You've no need. Have a cup of coffee, have a piece of chocolate, enjoy it.
All right, so if I can move on to Obamacare and the repeal and replace efforts that are going on in the part of senators right now. We'll see if something gets done this week, next week. They're coming back from the 4th of July break. So where are you at in the medical community on what you are seeing as the national conversation here?
So I work in a non-for-profit in Atlantic Health System out of Overlook Medical Center. And what we've seen is this worry from the immigrant population. We do take care of illegal immigrants in my hospital system because unfortunately someone has to. And it's become an issue of debate of who should be responsible for footing that bill. And because I work for a nonprofit system like Atlantic Health, we have a charity care system in place that's not funded by the government. It's actually funded by our non-for-profit system within the hospital. And if you look at the whole legality of Obamacare and the new repeal act that's being put forth, doctors don't get it. Because the practicing doctor doesn't have the time to look through the legality of the situation, the budgeting of the situation. Frankly, it's over our heads. Because we spend time taking care of our patients, and that's what's number one to us. What really needs to happen with this type of bill is we need to get doctors and politicians in the room together and see what's missing. Because politicians don't see patients. Doctors see patients. But doctors can't manage budgets.
Yeah.
They don't know how to create the legalities behind it.
So, Dr. Mike, part of your popularity is that you provide explanations and give some advice to people on YouTube, just like this example.
Links between eczema flares and diet has been a popular subject that's been up for debate. It's not clear what the link is, but we certainly know that a link does exist. I don't like recommending to my patients eliminating certain foods from their diets, but this is a great time to have a conversation with your dermatologist or your primary care doctor to get tested for food allergies.
All right, so I mean, this is what you do. You give online advice. People love this. They're eating it up.
This is what's important. I'm a primary care doctor. I'm a family medicine physician. My job is to not only educate people, but prevent problems from happening in the first place. And that's what I really look forward to lawmakers taking that into consideration. We need to focus on prevention.
So what's your message to them right now as they are getting together and trying to work this out? And it is a difficult process, as the president keeps saying.
Absolutely. I think the things that need to be focused on and not lost in the conversation is prevention is key and research is key. Because if we focus on those two things, we'll really secure ourselves a great future, not only financially.
Are you concerned about the future of healthcare in this country?
Absolutely, absolutely. Because if you think about it, who should be reimbursed more? The doctor that prevents a cancer from happening in the first place through proper screening, or the doctor that actually puts the cancer into remission once it's already there? It's really a difficult topic to talk about, but primary care doctors are the ones that are catching cancers early, screening patients the right way, and preventing all the cost and burden that's associated with illness in the first place.
All right, so I have to get to this because we mentioned your 2 million followers on social media. You have achieved Instagram fame. What was it like to get named the sexiest doctor alive by People magazine.
Oh my God, it was a very honorable title, to say the least. My patients, my coworkers, we all take it with a grain of salt. It basically adds a little humor to our Monday mornings.
Where are these pictures coming from?
Wow. This is my social media right here.
Look at this.
What this has allowed me to do is to show to patients that doctors are humans too. We're relatable. Come in and let's have a conversation about your health. Let's see what's going on in your life that you could be doing that's causing extra risk that you don't need for it to be there.
Wow.
So I put up photos, I put up pictures of my everyday life, make YouTube videos about common subjects.
People are eating it up, doctor.
People are eating it up. People are coming in just because of the social media thing, and we're catching and curing cancers early.
All right, where do you come from, doctor?
I was actually Russian born, but I'm a New York guy, 20 years.
Wow, very good. Wonderful to have you here.
Yeah,
the doctor is in. Thank you for
so
being
much,
here.
Sandra. Appreciate it.
All right, good to see you. Mikhail Dr. Mike Varshavski, sexiest doctor alive. Thanks for joining us.